According to the Chartered Society of Physiotherapy's definition, physiotherapy helps to restore movement and function when someone is affected by injury, illness or disability. It can also help to reduce risk of injury or illness in the future. Physiotherapy can improve your physical activity while helping you prevent further injuries. This year, 1 in 5 people within the UK will suffer from chronic pain or injury, in spite of having undergone various tests and examinations with numerous clinicians. Many patients fail to receive an adequate or even accurate diagnosis of their pain or injury. Our clinical mission is to help each patient recover in the shortest space of time possible, at the lowest possible cost, and with minimum amount of disruption to their life and the lives of those around them. And we've helped thousands of patients from all ages and all walks of life find relief from pain and injury. And now we'd like to do the same for you. So there's, broadly speaking, 4 types of patients we tend to see present to our chiropractors and physiotherapists here at the clinic. One being those with no pain or injury whatsoever, individuals who are purely looking to legislate against development of pain and injury and look after their musculoskeletal system in the same way that we look after our teeth. And we're all really familiar with seeing a dentist, but people are now cottoning on to the notion of, well, I look after this part of my skeletal system, why am I doing nothing with the rest of it? So that's sort of group 1 of patients. Group 2 are those presenting with simple orthopedic or neurologic problems, back problems, knee problems, shoulder problems, headaches, etc., etc. Then there's the professional sporting patients, and they're all super fit and healthy, usually very little wrong with them, but the main reason that we'll tend to see them is if they've got something they don't want to present to their club. And then right on the other end of the spectrum, we've got what we call our chronic and complex pain patients. And these are the more long-standing cases. Very often patients will have had a whole raft of surgical procedures. They'll have seen a whole host of other clinicians beforehand, and they might be on a range of pharmaceutical drugs to help manage their pain. Now, the reason that I mention these 4 cases is to emphasize the fact that even though they're all really different, the first step that we want to take with any one of them will always be near identical, and that's to make as much of a clear-cut and thorough working diagnosis as possible, to really hit the nail on the head with exactly what's going on from the get-go, because that's ultimately what's going to determine whether we travel north, south, east or west with regards to the management of somebody's case. With any patient, we'll begin by taking a full and thorough clinical history of your complaint, as well as a past medical history and family history. This will be followed by a comprehensive physical examination consisting of orthopedic, neurological, postural, gait and functional evaluation. If we feel that further testing or investigative imaging, i.e. an MRI scan, CT scan, ultrasound scan or X-ray is required, we can refer you swiftly and efficiently to an appropriate specialist. Immediately following your consultation and diagnostic service appointment, your clinician will take time to evaluate your findings and formulate an appropriate evidence-informed treatment strategy. Thereafter, we'll sit down with you and discuss your case in full, and we'll let you know a diagnosis of your complaint, what it is and what's causing it, a prognosis of your case, how it's expected to progress or how long it will take to get better, an outline of proposed treatment, and if we deem ourselves suitable for the management of your complaint, then we'll inform you of what we can do to help, what you'll be able to do in order to help yourself, the results that you can expect, the rate at which you can expect those results, and any associated costs. If we feel that your complaint would be better managed by another clinician, then an appropriate referral to that clinician will be made without delay. Treatment will typically encompass a full array of gentle and evidence-based conservative care procedures, such as mobilisation and manipulation of joints, soft tissue work, dry needling, and rehabilitative exercise prescription. This care will be delivered within a modern biopsychosocial framework, integrating pain science education, graded motor imagery, pacing and graded exposure, acceptance and commitment therapy, and cognitive behavioural therapy, as well as much more. Ultimately, each patient's care is tailored to their case, taking into consideration their own personal requirements and preferences. And we understand that patients might be apprehensive about treatment, and hence we do our utmost to ensure patient comfort and reassurance throughout. Whether you're looking to live a life free from pain, improve your musculoskeletal health, or push for the peak of your athletic and sporting performance, we can't wait to welcome you to one of our clinics soon.